Today we're re-diving into a topic that affects millions of people around the world, but is often misunderstood. Inflammatory bowel disease, or IBD. If you've ever struggled with digestive discomfort or know someone who has, you'll want to stick around. Let's get started. 1. Let's begin with the basics. What exactly is inflammatory bowel disease? IBD is an umbrella term used to describe two main conditions: Crohn's disease and ulcerative colitis. 1. Crohn's disease. This type can affect any part of your digestive system, from your mouth all the way down to your anus. The inflammation can affect the full thickness of the bowel wall, making it more severe in some cases. This means that inflammation can occur in patches along the digestive tract, which is why Crohn's is often harder to diagnose. 2. Ulcerative colitis. Unlike Crohn's, ulcerative colitis affects only the large intestine or colon. It usually starts at the rectum and spreads upward. The inflammation in ulcerative colitis typically affects just the inner lining of the colon, making it a bit easier to treat in some cases. Both of these conditions involve chronic inflammation of the digestive tract, leading to symptoms that can significantly impact your quality of life. 2. What causes IBD? Now you may be wondering, what causes IBD? Unfortunately, the exact cause isn't fully understood, but there are several factors that are thought to contribute to the development of IBD. Let's break it down. 1. Genetics. If you have a family member with IBD, your risk of developing it is higher. Certain genes make you more susceptible to IBD, which is why family history plays such a major role. 2. Immune system dysfunction. IBD is often considered an autoimmune disease. This means that your immune system, which is supposed to protect you from infections, mistakenly attacks your body's own tissues. In the case of IBD, it attacks the digestive tract, causing chronic inflammation. It's like having a security system that turns against your own home. Instead of protecting it, it starts to cause damage. 3. Environmental triggers. While genetics plays a role, environmental factors like diet, stress, and even certain infections can trigger the onset of IBD. For instance, high-fat diets, smoking, and antibiotic use have been linked to an increased risk of developing IBD. It's like adding fuel to a fire. Once the inflammation starts, these triggers can make it worse. 4. Gut microbiome imbalance. Your gut is home to billions of bacteria, both good and bad. When the balance is disrupted, it can lead to inflammation and contribute to conditions like IBD. Think of it like a well-maintained ecosystem. When one species becomes too dominant, it throws everything off balance. Common symptoms of IBD. So, what symptoms should you be looking out for? While IBD symptoms vary from person to person, here are some of the most common signs. 1. Abdominal pain and cramping. The inflammation in the digestive tract can cause intense discomfort and cramping, especially after eating. 2. Chronic diarrhea. This is one of the hallmark symptoms of IBD. Some people with IBD have frequent bouts of diarrhea, often accompanied by blood or mucus in their stool. 3. Fatigue. IBD can cause exhaustion, even if you've had a full night's sleep. This is due to both the inflammation and the body's response to it, leading to feelings of constant tiredness. 4. Unintended weight loss. When the digestive system isn't absorbing nutrients properly due to inflammation, weight loss can occur. This can be further complicated by a reduced appetite. 5. Blood in stool. Blood in your stool is a serious symptom of IBD and often signals the need for immediate medical attention. 6. Loss of appetite. Digestive distress from IBD can make it difficult to enjoy meals, leading to a reduced desire to eat. This in turn can exacerbate symptoms and lead to weight loss. How is IBD diagnosed? If you're experiencing symptoms of IBD, it's important to see a doctor. Your doctor will likely start by taking a thorough medical history and performing a physical exam. From there, they'll likely recommend a series of tests to confirm the diagnosis. 1. Blood tests. These help identify signs of inflammation and anemia, which can be a result of blood loss in the digestive tract. 2. Stool tests. A stool sample can help rule out infections or other diseases that might be causing symptoms similar to IBD. 3. endoscopy, or colonoscopy. These procedures allow doctors to examine the lining of your digestive tract to look for signs of inflammation, ulcers, or other abnormalities. Think of it as sending a camera into your gut to get a closer look at the problem. 4. Imaging tests. CT scans or MRIs can be used to provide detailed images of your intestines and help identify areas affected by inflammation. Treatments for IBD. While there's currently no cure for IBD, the good news is there are several treatment options that can help manage symptoms and improve your quality of life. Treatment plans vary depending on the type and severity of the condition, but here are some common options. 1. Medications. Anti-inflammatory drugs like aminosalicylates and corticosteroids can help reduce inflammation. Immunosuppressants are also often used to help control the immune system's response. For more severe cases, biologics can target specific immune system proteins that cause inflammation. 2. Dietary changes. A healthy diet is crucial. While there isn't one specific IBD diet, many people with IBD benefit from eliminating trigger foods like dairy, gluten, or processed foods. Fiber, lean protein, and anti-inflammatory foods like turmeric can help ease symptoms. 3. Surgery. In some cases, surgery may be needed, especially if medications aren't effective. People with severe Crohn's disease may need to remove parts of their intestines, and people with ulcerative colitis may need to remove the colon entirely. 4. Stress management. Since stress can trigger flare-ups, incorporating stress management techniques like yoga, meditation, or deep breathing can make a huge difference in managing IBD. Coping with IBD and living well. Living with IBD can be challenging, but it's absolutely possible to live a full, active life with the right treatment and support. Many people with IBD find ways to manage their symptoms and thrive. It is all about finding a treatment plan that works for you and making lifestyle changes that support your overall health. Whether you're newly diagnosed or have been living with IBD for a while, remember you're not alone. There's a large community of people with IBD who understand what you're going through. Seeking support from others, whether online or in person, can be really helpful. 2. If you found this video helpful, be sure to hit that like button, share it with someone who could benefit, and subscribe for more health tips. If you're living with IBD, let me know in the comments. I'd love to hear your story and offer support. Thanks for watching, and I'll see you in the next video.